There are certain things many seniors say during a doctor's visit without realizing those exact words can actually hurt their care. And today, I'm going to break down the biggest ones, and more importantly, what you should say instead, because this isn't really about saying the wrong thing. It's about how small, everyday phrases can completely change how your doctor understands what's happening inside your body. And I've seen this happen over and over again. I've been a nurse for over 30 years. And if there's one thing I can tell you, it's this. Communication matters more than people realize. It's not just about what's happening in your body. It's about how you describe it. Because your doctor isn't with you 24/7. They're relying on what you tell them. So when certain phrases get used, even casually, they can accidentally minimize, confuse, or delay your care. Let's start with the classic, "I'm fine," and I get it. This is almost automatic for most people. But here's the problem. "I'm fine" tells your doctor nothing. I've seen patients say, "I'm fine," and then 2 minutes later describe pain, fatigue, dizziness, trouble sleeping. That's not fine. That's critical information your doctor needs. I remember one patient in particular. She came in and said, "Oh, I'm fine." But as we kept talking, she casually mentioned she'd been getting dizzy almost every single day. She just didn't think it was worth bringing up. And that's exactly how things get missed, when everything gets labeled as fine. What you could say instead is, "I'm okay, but I've been having," or "I feel mostly fine, but this has been bothering me." That one small shift gives your doctor something they can actually work with. Now, this next one drives me a little crazy. It's probably nothing, but, and then they describe something that absolutely should be evaluated. Here's the issue. When you minimize your own symptoms, your doctor may unconsciously do the same, not because they don't care, but because you've already framed it as not important. And I've seen this delay diagnosis more than you'd think. Instead, try saying, "I don't know if this is serious, but here's what I'm noticing." Now you're sharing, without dismissing. All right, this next one. "I didn't want to bother anyone." I hear this all the time, especially when symptoms have been going on for days or even weeks. This is actually exactly what landed my mom in the hospital when I was 16, with an ovarian cyst the size of a grapefruit. So let me say this clearly. You are not bothering your doctor. That is literally their job. And I've seen so many situations where someone waited and waited and waited. And by the time they spoke up, the issue was much harder to manage. Instead, say, "This has been going on for a while, and I wanted to get it checked." Simple, direct, helpful, and even better, bring it up the moment you notice it. Now, this next one sounds polite, but it can actually work against you. "Whatever you think, doctor." Because now you've removed yourself from the conversation, and good care is always a two-way conversation. Your doctor brings the medical knowledge, but you bring your experience, your preferences, your priorities. And I've seen better outcomes when patients stay actively involved. I remember one patient who kept saying, "Whatever you think is best." And on the surface, that sounds cooperative. But when the doctor started explaining options, we realized there were things that mattered deeply to her, that she never mentioned, things that would have changed the entire plan. But no one knew, because she didn't say it. Instead, you can say, "What are my options?" Or, "What would you recommend? And why?" That keeps you involved, without being difficult. Now, this one. As a telehealth nurse, I hear it all the time. I Googled everything, and this one goes both ways. Some people come in saying, "I looked everything up, and I think I have 5 different conditions." And others say nothing at all, even though they're worried. Here's the truth. Your doctor already knows you're thinking about it. So it's okay to say, I looked this up and it made me wonder about. That opens a conversation instead of creating tension. And then we have this one, I forgot. You get to the appointment and suddenly forget half of what you wanted to say. And later you think, why didn't I bring that up? I see this happen constantly. Important details get missed, and those details matter. So what should you do instead? Write things down, even just a few bullet points. Symptoms, questions, concerns, because your appointment is your time, and you want to use it well. And if you're not sure what to write, here's a simple framework. What am I feeling? When did it start? Has it changed? And what concerns me about it? That alone gives your doctor a much clearer picture. And here's a little insider tip. The more specific you are, the easier it is for your doctor to help you. So here's the bottom line. Your doctor isn't just treating your condition. They're responding to the information you give them. And small changes in how you communicate can lead to better understanding, faster decisions, and more accurate care. And I've seen this make a real difference, again and again. And honestly, this is exactly why I created my free guide, What to Say at Your Next Doctor Visit. It's designed to help you stay organized and advocate for yourself like a pro. There's a link down below. You can download it for free, because knowing what to say and how to say it can completely change your experience. And I'd love to hear from you. What's something you've said at a doctor's appointment that you later wished you'd said differently? Or something you weren't sure how to bring up? Drop it in the comments, because chances are you're not the only one. See you next time.